Also in southern Utah, doctors and nurses at St. George Regional Hospital overwhelmed by an influx of patients, according to the medical director. The governor also addressing this issue with state health leaders this week. ABC4's southern Utah correspondent Jordan Verdadero has that story.
St. George Regional Hospital is seeing 3 times the number of COVID-19 patients in the last 10 days, according to the medical director, Dr. Patrick Carroll.
The number of patients in the hospital we're seeing is more than the normal numbers. About 30 of those patients are because of COVID.
While the majority of patients aren't COVID-19 cases, he says it's putting a strain on employees with a shortage of staff and resources.
We don't generally anticipate this number of patients in the summer.
Dr. Carroll says nurses and doctors are still recovering from the winter when southern Utah saw a spike in positive cases and hospitalizations. State officials say this isn't only an issue down south, but all over Utah with the recent rise in COVID-19 cases due to the Delta variant.
And we are headed into the most highest volume trauma weekend we have every year. So I want to echo what Governor Cox said is we need you to stay safe because burns, ATV accidents, drownings are going to put a stress in our system. The biggest difference is that we had staff to open an additional ICU that we ran for 9 months. We don't have those staff now.
Carroll says their ICU is also nearing capacity and they may have to soon expand it to other parts of the hospital like they did in the winter. Reporting in St. George, Jordan Verdadero, ABC4 News.